Today on 13th and Park, we welcome into studio America's CMS Administrator, Dr. Oz, the world-class cardiac surgeon, author, and Emmy Award-winning TV host, who now leads the nation's Medicare and Medicaid programs. Dr. Oz has spent decades helping Americans think differently about health and wellness, and together with RFK Jr., they're setting out to improve the healthcare system by fundamentally challenging it to be better. Because Dr. Oz believes the real revolution rests not in treating illness, but preventing it. From Ballard Studios in the nation's capital, a very special episode of 13th and Park.
The hard things that are necessary, we either do it or we'll pay the price down the road.
That often is missing in politics.
We have to solve everything.
It's a nightmare.
You and I can differ, but that doesn't mean you and I cannot be friends.
I have faith in the American people.
Those are the facts.
The Illuminati, right there. Aliens could have invaded and nothing would surprise me at this point.
We went from North Korea to M&M. That's a lot, man.
What's in this tea?
Well, Dr. Oz, welcome to the show. I understand when you came into the airport last night, you did a number of selfies as people are coming up to you and approaching you. Does it ever get old, especially in the role you now have as administrator at CMS, that you're in a place where you're making a fundamental difference in a huge way in so many lives, and clearly you enjoy it?
I think this is the best job I've ever had in my life. And I've had fabulous jobs. Loved hosting the show. Doing heart surgery is such an honor, but there's also something so fulfilling about looking patients in their eyes.
Yeah.
And knowing you're there for each other.
Mm-hmm.
You just can't replicate that. But the ability to work with a bunch of incredibly talented individuals, which is the people at CMS by their nature, they're numbers people, they're actuarials, they know how to run insurance systems, they understand healthcare policy. I mean, really sophisticated stuff. And these folks, mission-driven, gave up wonderful jobs, usually on the outside, better paying jobs almost always, and came into government because they realized they could make a difference. So when I'm asked to take a selfie, which, by the way, I still feel honored by. And I say that with great sincerity because it takes so little effort to smile.
Yeah.
But the fact that someone wants a little bit of smile to cheer up their day and they're going to send it to their friends, it's going to make a more notable experience for them. Why would you not do that? It takes just as much time to be a jerk and say no as to just turn and smile for a second. It is the easiest and wisest thing to do in any kind of large environment is just get them out of the way, get people happy, and then move them from that little bit of tangible evidence that you were together to something that's more moving, more substantive. If I give it one bit of advice to everybody who's listening right now, we're not going to fix the healthcare system without empowering patients. Mm-hmm. And the way you empower patients is to make them better students for their doctors and get them to ask their doctors tough questions. That way you have a true dialogue to get the best results for you and your family.
Well, you said beyond just being courageous and compassionate, you're challenging all patients, all Americans to be curious. Have a curious mind. Look more deeply. Do your own homework. So when you have an interaction with a provider, any interaction having to do with your health, you're kind of informed.
I go one step past that and say, if you want to understand the MAHA movement, I'll give you one word.
Okay.
Curiosity.
There you go.
As you point out, if you're truly curious, remember, you're an interviewer, you know this, 80% of questions are statements in disguise, right?
Right.
Don't you think that? Well, that's a statement. You're not really curious about my answer. So if we can do it correctly, we'll get patients to be curious.
Yeah.
Hopefully even before they become patients. It's like a parent loves their child, sees all this evidence that something might be useful, but they want to double check just to be sure.
Sure.
And so if you're truly curious, you ask questions with an open mind, you'll get insights sometimes aren't agreeable. They're not the ones you were hoping for. What do you do with that information?
Yeah.
This is where I think Secretary Kennedy is so special. He's just not willing to compromise. If you're curious and you hear something that should be spread, the wisdom should be widely disseminated, then you've got to be courageous enough to share those insights.
That's it.
And then you have to be ideally compassionate as you do it because people get scared. I want people to be competent in my agency, and I tell them that. I want us to be established without question as the best payer of all. And I also want people to be cheerful. And I know that sounds like crazy, but cheerfulness matters to me because life has difficult moments.
Yeah.
And it could be dour and sour and, struggle through the whole thing, meandering. But I always recount the story of what's a lucky person. So they did a study, tried to define what luck means. And so they had people walk between two different points in a crowded city street. Yeah. And halfway through that walk, they placed a $100 bill. The lucky people found the money. The unlucky ones didn't. Because the lucky ones were looking.
Right.
Luck favors the prepared mind. If you're out there trying to find wisdom, insights, opportunities to make a difference, or a $100 bill on the ground, because you're open-minded and searching, you find things. Whereas closed-minded people walk right by them. That's why I think art and science intersect so beautifully, because art fundamentally, and artists, they have an ability to connect dots that aren't that obviously related from folks who are not in the art space.
Right, makes sense.
Science is much more linear, obviously. But you put them together and magic happens. And much of what has defined science has often had an artsy element to it. I'll give you a concrete example. 1871 Paris Exposition. First time ever there was a large endeavor to show what Impressionist painting represented. At its core, what it said was dots could make lines and create images. 25 years later, 30 years later, Einstein's sitting in a train station in Bern, Switzerland, and sees the train pull out and the Doppler effect of the red light, and starts to go one step past that and begin to realize that waves of light are actually dots. So particle theory and wave theory are actually interacting, and that's the whole foundation of complementarity. Complementarity is having two mutually exclusive ideas that are both true. It sounds crazy, but it's the foundation of reality, right? Particles exist, but they behave like waves. Waves are real, but they actually are made up of particles. So you think, well, my goodness, is one or the other? No, it's not one or the other. And politics is like that. Oftentimes there's complementarity. Two mutually exclusive ideas can still both have veracity. Part of my job at CMS is try to see those opportunities. What's the best way for me to pay for somebody who's in the vulnerable camp, who's really down on their luck and has trouble taking care of themselves? How do I get them to care enough about themselves and get people around them to give them a second chance to get them back on their feet? And if I just take the approach that I take in Medicare and apply it to Medicaid, Medicare for older patients, Medicaid for younger patients, but patients who don't have resources, well, there's a different populations. They behave differently, they act differently, they run their lives differently. So you need different approaches to managing them.
Let's talk about Make America Healthy Again, MAHA. In the international rankings, we're not even in the top 10 in terms of delivery of healthcare. We should be best. I mean, it's mind-boggling. We're not there. What took us so long to kind of come to grips with that? And why is there such resistance, or should there be any resistance, to changing a system that is still holding us back to delivering the very best healthcare in the world?
Well, you never want to waste a crisis. And we're in one. And I think the wake-up call amongst policymakers anyway is an appreciation that it's not sustainable. And the old approaches, basically, which was throw more money at the problem, it just isn't working. You mentioned something that's very interesting, that we're not in the top 10 in health outcomes. In some areas like maternal mortality rates, we're dead bottom, dead last.
Terrible.
But we spend twice as much per capita as any country on the planet, usually 3 or 4 times more. So what's going on? We're spending a lot of money, but we're not getting value. We have a growth rate in healthcare that's 3% faster than the economy. We have number 3 cause of death being health mistakes in healthcare. We have a general lack of appreciation of how much control we have over our future. And so when you have an obesity rate in America that's 43%, you're going to be more expensive, because the number one driver of healthcare expenses is obesity and chronic illnesses that are caused by it. So there's a lot of things we can do to improve the system. I'm not nihilistic at all. Quite frankly, that's my biggest enemy. People think, oh, you can't fix it. We've been trying so long. It's not working. Not at all. We really haven't been trying.
We haven't tried it.
No, we haven't done the things that a thoughtful nation would do. And part of it, and this is again why MAHA is so important, I divide it into 3 categories. You have to deal with people at the end of life, so managing that, and we should talk about that later on. We got to deal with the chronic illnesses we have that I just touched on: diabetes, hypertension, chronic lung disease, all these things that are often caused by lifestyle changes. But the real way you win the battle is to prevent it from happening in the first place. That's what MAHA is saying. We've made it hard to be healthy in America. It doesn't make any sense for us to repeat the same basic maneuvers that got us here, which is, of course, the definition of insanity, is to think it would make a difference if you do it again and again and again and again. We have got to figure out ways of empowering people. So I'll give you a example, a tangible one. About a month and a half ago, we went to the White House for a massive event that the president wanted to host, which allowed the top 60 technology companies in the country to pledge to support a digital transformation of healthcare. They did that because they realized, well, there's a lot of money there, so they can make money there. But they also realized that we're not doing it well. And because of the inner fighting, the internecine battles that have happened, we're actually blocking Americans from using technology to better their health, the same way they use technology to watch streaming videos or do banking, or most of the things these days in our lives. You would never think about doing them the way you did them in 1965. But Medicare and Medicaid, which were created in 1965, so they're 60 years old this year, have not evolved in some of the ways you think it should have evolved. So, for example, a patient whose medical records they own, right? They pay for them. You pay for your medical care. They can't get access to their medical records oftentimes, or it's such a hassle, they can't get it and share it as they would like to in a secure fashion. We should let private sector solutions connect with people who need their help, like every other part of the U.S. economic sector, and international markets are open for these folks as well, and create a large health ecosystem, an app ecosystem that allows people to get the best care possible. If you're a 75-year-old African-American woman who's starting to have early dementia, maybe you need an avatar, agentic AI, an empowered tool that culturally relates to you and can give you advice about stuff that maybe you're forgetting a little bit of. So it takes a little heat off the family. If you're a young guy who, tore a tendon, you get a very different set of tools that you might want to have. And all these are extenders of the healthcare system. So you don't need a doctor in rural America taking care of that 75-year-old African-American woman I'm speaking about.
Right.
They can have someone like an avatar help for a while, then get engaged as they need to. I bring up this as a concrete example because there's some challenges that are so large that we need to take real swings, hard swings.
Like?
Rural healthcare in America.
Good. I'm glad because you just penned an article with RFK Jr. on rural healthcare. It's the $50 billion commitment to rural healthcare. The state of healthcare in rural America is deplorable. You're almost compromised. Your health is compromised if you live in a certain zip code that happens to be outside of a major city, right? How important is getting that right? And couldn't rural healthcare, this initiative in rural healthcare, become a model for the way to do things under MAHA that we haven't done universally across the country?
That last comment, and I appreciate you making it, it requires such deep insight. The $50 billion that the president and Congress allocated to rural America, which is, by the way, 50% more money than Medicaid currently spends in those areas.
Right.
And your zip code does define your health, as you point out. So we want to change that. That's embarrassing for us to have to acknowledge, but it's the truth, so let's deal with it.
Mm-hmm.
If we can get this right, these ideas are scalable. If we can help small rural hospitals have a census of one patient, work with a large academic center that's really, really good at baby delivery, it makes that small hospital capable and competent of delivering babies as well, which means people living in those communities will start using those hospitals again. It creates vitality within rural America. If we can create opportunities for nurses to work in those communities and train more nurses at community colleges near these rural areas, those LPNs, they will stay there.
Right.
And we're asking every governor, because the money is being given through CMS, through my agency, Medicare and Medicaid, to the governors. And I met with almost all of them. And the governors want the money and they understand the challenge. This is really a space race. Give us your best ideas. Work with other states, come up with even better ones. But don't dilly-dally. This is a race. You only have till the end of the year to finish this whole process. But we're going to find incredibly clever ideas that come out of rural America to fix rural America. And some of those are scalable to urban America.
There you go.
And when that happens, then all of a sudden, for example, this app ecosystem that I mentioned to you, if you figure that out in rural America to provide better mental health services, because we've got a 50% higher suicide rate in rural America than urban America, my goodness, those same tactics are going to work, maybe with minor modifications in other parts of the country. And they're scalable to other nations as well, which is a profit motive for companies to want to do this, because we're going to be tough on the money. I negotiate them. That's my Turkish heritage. It comes with a name.
The president kind of is aligned with you on that.
Yeah, well, the president, he's a superb negotiator, and he knows the game. So he'll call you up and say, that wasn't good enough. Go back and get more. He's a wonderful boss, by the way. I mean, really a spectacular human being. And most people only know him from the press reports about him. But I wish they just had 5 minutes with him in a room, because it's hard to work with the president and not adore the man that he is deep down beneath everything else.
You had that experience with the president way back, your first experience in meeting Donald Trump. It was when you needed help with a charity golf tournament. You explained this to then Donald J. Trump, and he asked a couple of questions and he said, course is yours. I mean, is that the kind of guy he is that maybe the public doesn't see as much of?
Well, it was my first introduction to him, and it has turned out to be just about every interaction with the president. The request for the golf course happened over 20 years ago. I mean, neither of us were where we are now. I didn't have my show yet. I was just a heart surgeon in Columbia, so he wasn't trying to impress me.
I like that, just a heart surgeon in Columbia.
But I'm just saying that was my whole aspiration in life, was to be a heart surgeon. I was so proud of myself for reaching my goal, as everyone should be when they, when you're a little kid, you want to be something. I wanted to be a heart surgeon. But I wasn't notable, and there was no indirect benefit to the president. And I went to visit him because there's a foundation I'm passionate about. We've raised over $100 million for this foundation.
Good for you.
It's based on the principle we could mentor kids and get them to be healthy and take care of themselves. And by doing that, widen their horizons, get them to realize they are worth it. So I went to the president, gave him a quick pitch. He said, okay, you can have the course. I said, well, how much do I pay? Who do I talk to? He goes, no, there's no money.
There you go.
Just take the course. I want to just connect the dots between that episode many years ago and what happened very recently when I wanted to be sworn in by the president in the Oval Office. He said yes, and he said I could bring the family. which was the whole point, to get the kids in there. So I bring my grandkids.
Right.
And the oldest grandchild is 11 years old, little waif of a thing. And she got up at 4 a.m. with her parents, drove down, hadn't eaten breakfast. Rookie errors. She's only 11. So we do the swearing in. Secretary Kennedy's with me. We do speeches, the president. Then we have a press conference. This is going on for a while now. And she faints.
No.
She faints. She collapses.
In the Oval Office.
In the Oval Office. Whenever there's an event like that around the president, that's always a security risk. So they immediately push all the reporters out. There's probably 100 folks in there. So they quickly get them out of the Oval Office. And meanwhile, my grandson's stomping around, and the president says, looking at me, he says, I don't want to get on the wrong side of that tank over there. Bring him over here. Right. And this is the grandfather, part of the president that often doesn't get appreciated. Yeah. He sits at the Resolute desk in the Oval Office. He calls John over, my grandson. He goes, come over here, sit next to me. He said, you can go through this desk. It's called the Resolute desk. Pick anything you want. And so he opens the top drawer, and there's this massive presidential coin there. John's eyes bulge out of his head. And the president gives him the coin, but this is the part of the story that I think is critical. He says, okay, John, your sister wasn't feeling well. I think she's getting better. What are we going to give her? He's testing John. So John looks at the president, looks at the coin, looks at the president, looks at the coin. He says, I'm going to give her this coin, which of course is the whole point.
Yeah.
So the president says, no, keep your coin, brings the little girl over. She gets a coin too. And then the field, of course, being a girl, says, well, the coin's nice, but what about the pens? It takes all the presidential pens. Right. That part of the president, when you see it reproduced over and over again for people that are in the administration or around him. I remember going to a golf course that he owns and talking to one of the folks there who was extraordinarily defensive about the president, trying to make sure that everyone appreciates how great guy he is. I said, give me an example of what defines him. And he says he's never seen him be mean to anybody at the course. And in fact, when he sees someone who's obviously like a lower level person, he'll often come over to them and just squeeze some money in their palm to make sure in a way that he can, that they know that they matter to him. And that's how you build teams.
One of the things that you focused on, and of course the president is focused on, is waste, fraud, and abuse. An executive order was signed to that effect. How do you make sure you go after that and go after the bad players while not compromising potentially the good ones and continuity of care?
Little secret.
Yeah.
The good guys want you to get the bad guys.
There you go.
It hurts them. We've all bought braces, wheelchairs, crutches. Right? That's, people who sell those things are generally well-meaning, hardworking, many times mom and pop boutique stores. There's a tremendous amount of fraud in that space because you don't need a lot of things to get into it. And you realize that it's like a garden. Once you have weeds in part of the garden, it takes over the garden and it begins to kill off the good plants. Yeah. So the good guys don't want that. They actually tell them the bad guys. Yeah. Fraud is taking money from our most vulnerable. And it's usually either reprehensible people or foreign multinational syndicates. We had a $15 billion takedown with the FBI and DOJ of a multinational syndicate based out of Russia that was trying to get $15 billion, but we stopped them. Because once we knew this was happening, we were able to at least prevent $12 billion from leaving the building. Because once it leaves the building, it's gone.
It's gone, right.
But $2.9 billion we lost. Yeah. $2.9 billion. One of the beautiful things about this administration I have found is that the silos that traditionally exist have been melted down. Part of it's because we actually get along. Like Secretary Kennedy and I are personal friends for many years. Marty McCary I've known for a while. Jay Bhattacharya, who runs NIH, we are very close personal friends. Like we go out together. And so when I need something that I know how to fix, I'll call them. I'm not telling them, I'm asking them. Yeah. Help me understand what we can do differently here. And I think you're going to find and hear over the next couple of weeks some big breakthroughs around areas, for example, like autism and the like, that are really complicated because you're not going to get one agency fixing a problem that big, but you get all the agencies working together, rowing the oars together, and you send the message to your team. I don't want to hear about small little internecine battles. I know we're like cousins and siblings. You're going to fight. I get it. Right. But you got to sit down and have dinner together at night, right? You never go to bed mad. So work it out. The bigger narrative, the one that the president wants to hear about, is what do we do together to fix the problem? In fact, what I tell my team, and I firmly believe this, is my number one job is to hire the smartest people in America and then make sure they don't kill each other. Just, smart people tend to self-sabotage too, right? They tend to think they know more than everybody else. Sure. So fine, maybe you do more than everybody else, but you don't know more than everybody else in everything.
I know you can recite these words because you've recited them before, but there is that plaque on an HHS quoting Hubert Humphrey, that the moral test of government is how it treats those in the dawn of life, children, the twilight of life, seniors, and the shadow of life, the sick and needy. Is that kind of your mantra, kind of your guiding principle? Every day you get up and you think about, what can I do today to measure up to that standard?
All great people take care of their most vulnerable, and we're a great nation. Yeah. So we're going to do that. We have massive opportunities to make a difference for people who are down on their luck and want to get on the playing field of life. A great nation does that.
Yeah.
And by getting everyone engaged, that's how democracies prosper. So when Hubert Humphrey offered that line, which is so beautiful, and his use of light as a metaphor, so spectacular.
Yes,
but
right.
I want to point out that last line, help those in the shadows of life.
I love those words.
It describes where many people feel they are. And if we can get to those individuals, it makes a massive difference. And I'll give you a concrete number that might stick in people's minds. So the chance of someone who's on Medicaid, the insurance for folks who don't have much money, the chance of them canceling a doctor's appointment is twice that of a Medicare patient, an older person.
Wow.
And the reason I think is because when you don't have much money, you can't take time off from work. You're worried about losing your job. You don't have a car to get to the office.
Yep.
You don't have a support system. But there's something that goes beyond that when you talk about vulnerable populations. I actually personally think the most expensive problem in healthcare is loneliness.
Tell me about that. Why is that?
If you are lonely and by yourself, by definition, when you have a problem there, you have no one to crutch on. There's no one to double check that you're okay. There's no one to get you that extra lab test that would have made a difference, or pick up the medications from the pharmacy, or pick up a meal for you. Help you feel that there's a brighter future ahead for you. So fraud, waste, and abuse, those three words are critical. They're all the same thing. Fraud, I spoke of earlier, right? Multinational syndicates trying to steal from you. Abuse is you knowingly just don't care and do the wrong thing. It's unprofessional, wrong, but you didn't do it on purpose to steal. But the big buddy is the waste, is where we just throw money at problems because nobody wants to deal with them. Our nation is better than that.
So, Doc, first of all, I want to thank you for taking time out of a very busy schedule to come visit with us. I think right now, you're arguably playing the most important role of your life because all lives depend on it. We wish you all the best. You are clearly built for speed. One that likes to do your homework, and once you've been properly informed, your attitude is, let's go for it. And given where we are in America on healthcare, we can't move fast enough.
God bless you very much. I appreciate you for doing your homework as well. Very thoughtful, very insightful questions. As someone who's often sitting in your seat, I know how hard that is. So thank you for staying up late last night.
Well, I don't have any Emmy Awards behind me yet, but,
I'm sure they're coming.
working on it.
Take care.
Take care of yourself.